A downstate healthcare provider is sending help to Rochester to deal with a spike in COVID patients. Northwell Health is sending 8 nurses to Strong Hospital, and leaders outlined the plan this afternoon. Erica Cost joins us live now at Strong Hospital with that. Erica.
Good evening, Jack. This is all about paying it forward. Back in April of 2020, staff from Strong Memorial Hospital went down to Northwell to assist them as they were bearing the onset of the pandemic. Now it's the other way around, and the goal is to alleviate some of the pressure these nurses have been feeling in the ED, in the ICU for 2 weeks.
It's our duty as nurses to help one another.
After a quick orientation yesterday, Northwell nurses are ready to work. Between a buildup of more COVID cases, long-term care patients who can't get into nursing homes, and major staffing shortages. Karen Cady, a chief nursing executive with URMC, says they're in desperate need for this kind of help.
They're so happy to be here.
Brendan McDermott with Northwell says they've also been dealing with similar issues, but COVID cases are much less downstate, mainly because vaccination rates are higher. It's an opportune time, he says, to return the favor.
Especially since the fact that Rochester was able to help us when we were in need, to be able to return that favor is absolutely what nursing is about.
Our COVID rates per 100,000 people is 5 to 6 times higher here in the Finger Lakes than it is in New York City or Long Island.
8 nurses will be assisting in the emergency department, where Director Wendy Allen Thompson says the demand is higher than ever.
Our ED was designed for approximately 60,000 visits per year, and over the past few years it's been increasing, and we're up over 100,000 visits per year.
She was also one of the nurses to assist Northwell in 2020 and recalls getting a new perspective from them during that time, sharing experiences and picking each other's brains. Beyond the job at hand, she says it's a bonding experience of a lifetime.
I got more out of it than I ever dreamed I would.
And staff at Strong Memorial Hospital say they want this to be just 2 weeks because, remember, Northwell is going through some of the same difficulties as every hospital throughout the health system in the state. Staff here say any help is great, and these nurses will be back home in time for the holidays. In Rochester, Erica Cost, News 8.
Erica, thank you. Staff at URMC hope the governor's mask mandate, effective tomorrow, will help get a hold of COVID cases.